Garanja Gathoni, 3-minute-old baby boy, born in Nazareth Mission Hospital, Kiambu District, Kenya. This time, Jane Gathoni doesn't need to deliver her child in the dust in front of her hut, like she did with her last son. Thanks to a new output-based aid project, OBA, which has been developed by the medical advisor Dr. Yanish. Since 2006, the Kenyan authorities, supported by a grant by the German government, sell vouchers for reproductive health services. With this voucher, Jane can choose any health service provider for antenatal surveys, medical support at delivery, and postnatal treatment. 200 Kenyan shillings, about $3, Jane had to pay for the voucher. She has to pick 40 kilograms of tea for that sum. We visit Jane's rural home in Kiambu District 2 days before her son's delivery. She is still working. Jane belongs to those poorest of the poor who, in rural areas, make their living as casual workers at the tea estates or by digging on farms. 56% of Kenyans live below the poverty line. They would normally have no access to qualified medical service. Jane bought the Safe Motherhood voucher and intends to buy one for family planning. At this moment, she makes preparation to go to the hospital for delivery. For Jane, this first of all means waiting. Maybe there'll come a public bus, a matatu. If not, she has to walk for 15 kilometers. The reason that made me go for the voucher is that after my last delivery, it took me a long time to recover from the illness I got. It's taken a very long time to get the money. I had to borrow from a friend, and up to now, I haven't been able to pay back that sum. Finally, a matatu arrives and Jane can go to Nazareth Hospital. In Kiambu District, 17 various hospitals and health centers have been accredited to take part in the OBA voucher project, government, mission, and private ones. At Limuru Nursing Home, Dr. Patel has been the proprietor for nearly 30 years. He was overwhelmed about the dramatic increase of deliveries since the inception of OBA, and he's convinced that previously it was only the lack of money that prevented women from seeking health care at a hospital. Dr. Patel is content and thinking about more possibilities of services for the poorest.
That was the main motivation, that we would be part of the project in which the poorer community in our surrounding area would be helped and the facility would be used by them. We improve our facilities, as we already said that we started increasing the delivery bed, the incubator, even the staff, and even in the future, if we continue in the same sort of manner, we would like to improve these facilities in a better way, like putting in an ambulance.
During our trip through Kiambu District, we visit several hospitals and we see positive results everywhere. Since OBA, the numbers of deliveries and family planning treatments nearly doubled. With the OBA funds reimbursed, these facilities can now buy additional medical equipment, drugs, and hire more staff. Many hospitals have constructed additional wards. In AIC Kijabi Hospital, we accompanied the monitoring team during the quality check. This is done by the members of the National Hospital Insurance Fund. The quality of service provision has improved considerably. The competition between providers has resulted in a friendlier treatment of patients and quality of service. The patients are interviewed concerning hygienic standards, supply, treatment, and communication, and so on. The institution is regularly inspected, which takes a lot of time.
the guidelines issued be displayed?
They are displayed in the theater. You can see them opposite the resuscitator. And we are called for every C-section that there is.
Also time-consuming is the intense counselling of clients and the face-to-face marketing of the Safe Motherhood and Family Planning vouchers. The voucher distributors are the field staff hired by the Voucher Management Agency. At an OBA booth, located in central places of villages, they can reach as many women as possible. Their target group are the very poorest. With personal home visits, they verify the living conditions of every client to see if there is a real need. A woman has to keep below 16 points, which marks the poverty line on the standardized questionnaires. Only then does she have a rightful claim of being a beneficiary of OBA. Besides implementing the OBA project in 3 rural districts, it has also been established in 2 slum areas of Nairobi. Here we also meet lots of voucher babies and families who have benefited from the project. At last we visit Jane's family again. After delivery and first examination of both mother and child, she recovered after some days at the hospital, and now she proudly presents her healthy newborn.